Hello, my name is Elisa Glayback, and I'm here with Leslie Law and Zoe Bartlett. Today we'll be presenting on poor oral health amongst high-intensity sports. To begin, here is some background information on our topic. It is found that there is various bacteria that affect the oral cavity. In regards to tooth decay, it is found that Streptococcus mutans is the initial bacteria that causes the formation of decay. Lactobacillus is a bacteria that further progresses the decay with the help of a carbohydrate-rich diet. P. gingivalis is part of the red complex and is one of the main contributors to chronic periodontitis with the help of plaque and pro-inflammatory cells. It's found that high-intensity training leads to high frequency of carbohydrate-rich foods or energy drinks. This promotes the colonization of bacterial plaque within karyogenic microorganisms such as Streptococcus mutans. Intense physical training increases pro-inflammatory cytokines, inhibiting the activity of immune cells. This causes disruption of the oral microbiota and allows harmful pathogens to take over, such as P. gingivalis. High-intensity sports are defined as the maximum level of physical effort directed into a specific activity or movement within a sport. Examples of these sports would be boxing, hockey, wrestling, lacrosse, and swimming. Low-intensity sports are defined as low impact with low aerobic activity within maximum physical effort. Examples of these sports would be golf, curling, diving, and bowling.
Within our research findings, it was found that high-intensity sports are known to be more physically demanding and take a harder toll on the body. A study by the Republican Scientific and Practical Center for Sports Medicine, Tashkent State Dental Institute, aimed to identify if the frequency of training during different time periods had a significant effect on the periodontium. To perform this study, the researchers utilized 64 professional boxers and wrestlers aged 16 to 24 in pre-competitive and competitive periods. Periodontal disease and the prevalence of caries were found to be more prominent in pre-competitive periods, which required more endurance. Researchers hypothesized that this occurred due to the dramatic change in training within the pre-competitive periods. A study conducted by Azerbaijan Medical University wanted to review the relationship between the oral cavity and various high-intensity sports. The study used 200 professional athletes ages 18 to 25 between 2014 and 2016. It was found that a high level of prevalence of inflammatory periodontal diseases and caries was prevalent in all groups of professional high-intensity athletes. However, the researchers found that among the wrestlers, the prevalence of the periodontal disease was the most severe compared to the other sports. The researchers hypothesized that the wrestlers were more prone due to the intense power loads, dusty workout rooms, and constant traumatic injuries.
The method used was an evaluation of literature review research regarding oral health amongst high-intensity sports. In conclusion, the intense physical activity demanded from high-intensity athletes can promote harmful bacteria within the oral cavity, which in turn can facilitate the destruction of the periodontium. For example, increased frequency of karyogenic diets and the promotion of inflammatory processes. This can affect athletes' general health as well as performance during training and competition. It is found that high-intensity sports require more endurance and power loads that could take a toll on the body. The body and the oral cavity have a symbiosis relationship. Due to this, the research has recognized that there is a relationship between poor oral health and sports, which require high-intensity endurance and stamina. As physical activity increases, the periodontium decreases in health. There needs to be more research on the causalities and the prevention measures on this topic to further support athletes within their sports.